Okay, welcome to the aligner system in dentistry for establishing neuromuscular balance in a patient. Now, the goal of the aligner system is to gain balance in the human body. And I find that the human body, if it isn't structurally sound, has problems. And so the aligner system was developed so we can know where to put the maxillary teeth and the mandibular teeth to gain structural balance in the human body. Now, it's based on what we call the HIP plane, the hamular notch incisive papilla plane. In other words, if you take a skeleton, just bones when it's put together, and you put the head in an erect position, and you have the hamular notches, which is at the back of the mouth, back of the maxillary tuberosities, and the incisive papilla in front, and you have 3 points sitting there, and you put a plate across those 3 points, it should be horizontal to the floor. And when you mount models that you've taken onto the aligner, you're mounting those models to the HIP plane, and that is cranial bone mounting. After you do that, you're determining or you're diagnosing whether the alveolar arches and the teeth are within the horizontal plane that the brain will accept. So the main structure in the body that I feel has to be correct that isn't correct is the occlusal plane. So we mount a case, we take our models, we get the hamular notches and incisive papilla in the impression, and we mount it on the aligner, and then we take after we've got it mounted, we take these pins off which are used to do the mounting, and then we close the top back down and we look at the teeth to see if the plane of occlusion of the upper teeth in the alveolar arch are on the horizontal plane. So now you notice that on these skeletons, there's 2 types of skeletons there. One, everything is straight and correct. And you notice there's 7 horizontal planes in that skeleton picture. One goes through the eyes, one goes through the mouth, the other one goes through the shoulders, the rib cage, the hips, the knees, and the ankles. These are all planes that need to be horizontal to the floor or horizontal to the ground for a person to feel well and do well. If we don't have that type of a structure in the body, we have stress in the body. Now, some people can handle stress better than other people, but nobody handles stress over the long term. Now, you notice in the picture on the right, the skeleton on the right, that everything's crooked. There are 7 planes, but they're all crooked. A person with that kind of a structure is perpetually going to have problems. So, what is the common thing, the common denominator that would cause all those planes to tilt like that? And I believe the number one structure in the body that causes that is the plane of occlusion of the maxillary teeth. Because in those 7 planes, if one of those planes is canted or tilted, the brain, through muscle and tendon activity, will cant the other 6 planes trying to balance the body. The brain is always attempting to achieve neuromuscular balance in the body. If one of those planes is not horizontal to the floor, basically, then the muscles of the body, through the influence of the brain, will change the body. And that's what causes all the canting and the tilting in those planes that you see on that picture on the right. So what is happening in the body when that happens? Well, if you take the maxillary teeth, which are supposed to be horizontal to the floor, and you cant them up on one side, what will happen is the first vertebrae at the top of the vertebral column, the atlas, will shift sideways. The second vertebrae will rotate away from that shift. This will always happen. There's no way out. It'll always happen. Then down at the bottom of your spinal cord, which is the lumbar vertebrae, they shift exactly opposite. And then the vertebrae, as they come up and down through your back, shift in pairs. So anytime the maxillary teeth are not on the horizontal plane, you're going to have a tilting and shifting in the vertebrae. And that is called a scoliosis. People go to the chiropractor because they got pain in their back and their neck. Chiropractor looks, says, you got a scoliosis, we've got to straighten that out. And they try to adjust them to straighten that out. Now, whenever you have this scoliosis that takes place in the back, you also have a rotation, because anytime you have a vertebrae shifting sideways, you get a rotation. So now you have a scoliosis and a twisting of the vertebrae in the back. Sooner or later, and usually sooner, that's always followed by what we call a lordosis, where you don't have just the shifting going this way, but you have the shifting going front to back. That's called a lordosis. So whenever the maxillary teeth are not on the horizontal plane or very close to it, you're always going to have a scoliosis, a rotation, and a lordosis in your spine. Now, there was a fellow back in the 30s. He was a chiropractor, and he took a young fellow who was 16 years old and took a picture of him, and he had an absolutely straight back. Vertebrae straight, just what they should be, normal. And then, of course, front side view, just the right amount of curves. He had a dentist put a filling in one tooth that was just a tiny bit high, not real high, just a tiny bit high. Took another x-ray of that 16-year-old boy's spine, and he had a 2-inch scoliosis. So then he had the dentist cut the filling off, and he waited another 24 hours. He took another picture, and the backbone was straight. Then he had them the dentist put the filling back in, just a little bit high, took another picture 24 hours later, and he had a 2-inch scoliosis in the back, proving how the plane of occlusion of the upper arch, because the filling was in the upper arch, causes a scoliosis or a distortion in the vertebra of the back. Now, until the aligner was developed, there was no way of knowing whether the maxillary arch was level or not. There are no other instrumentation in dentistry that show whether the maxillary arch and the teeth in the maxillary arch are level to where the brain will accept it and not cause the spinal cord to twist and distort. About 70% of the people that come into my office on a general dental exam, when I ask them if they have headaches, neck aches, back aches, or chronic fatigue, they all say, yeah, I have that. 1, 2, or 3, or all of them, you know, they've had it all their life. No dentist has ever asked them if they had headaches or neck aches or back aches. Because after all, if they had that, what would the dentist do? Well, during this DVD series that you're going to see, we're going to discuss how to treat people that come in with those symptoms. But I want you to know right away, the key to all of that, the body structure being balanced, is the maxillary arch. Then after the maxillary arch is dealt with and leveled, then you're dealing with how the lower teeth meet the upper teeth and whether they're at the right length, and then how the joints up here work up here. But it all starts with the proper analysis of the upper arch with the aligner, and then knowing what to do after that, which you will learn as we go through this whole series on DVDs. So now I'll show you the basic instrumentation of the aligner. First of all, we have on the aligner a vertical column which goes up and down, so we can adjust the patient once they're mounted on here up and down for vertical height. We also have on the aligner a horizontal column, so we can move, once we get a case mounted on here, we can move them forward and backward. We can change the position of the lower jaw if we need to. Okay. This becomes important in making certain appliances and doing final dentistry. Then we also have on the aligner a lateral column so that we can actually shift sideways and study occlusion on the teeth and lateral excursion. So we can study how teeth are set when we're doing reconstruction dentistry and lateral movements, or when we're making appliances in lateral movements, or we're making dentures in lateral movements and in forward and backward movements, and then we can adjust the height of a appliance or a denture to where changes need to be made so the patient can be in neuromuscular balance. Top moves up, and we'll show you close-ups of how we mount on the aligner. But right now, I just want you to know all the motions and all that we can do in adjusting appliances and bites in patients so that we can use it for not only for making appliances for people who need to have their bite readjusted, but also in reconstruction dentistry and also in making dentures, and should be used anytime there's more than one tooth being adjusted in the mouth, and it should be used to analyze every patient that comes into a dental office to see if their structure is sound enough that their brain will accept it and create neuromuscular balance in the body, because anytime the maxillary is off to any degree, you have structural problems in the body. This can be a host of problems. The pain problems in the neck and back is only the start of it. It can be anything in the body, because once you have a scoliosis in the back and a twisting of the spinal cord, you can have a problem anywhere in the body, any organ system in the body. I've had a man who had an ulcer, and 2 hours with an appliance, his ulcer went away. Every time he took his appliances out, his ulcer was back in 2 hours, because his bite was not right. That affected his digestive system and his stomach. The vagus nerve goes into the stomach. I've had women with gynecological problems. I've had people who were suicidal, depressed, and everything in between, because the maxillary arch was not level and the mandibular arch did not meet it right. So we're going to discuss in the next hour or two or three, however long this is going to take, on what you need to do in appliance therapy and reconstruction therapy to create a healthy, structurally balanced person.